Good morning, everybody. First, I would like to thank the organizing committee for inviting me to join you today on this conference. Today, we are going to speak about Thyroid Cancer Registry. What is the current situation? We'll first talk for a little bit about the demography of population in Kuwait. In 2011, the mid-year population in Kuwait reached about 3,600,000 individuals. 60% of this population were males. Male-to-female ratio is 1.5 to 1. Kuwaiti represented about 1 million of those population, with male-to-female ratio 1 to 1. As for non-Kuwaiti population, they totaled about 2,500,000 individuals, with male-to-female ratio 2 to 1. Cancer is one of the major health problems in Kuwait. It ranked the second most common cause of death, preceded only by cardiovascular diseases. It carries about 1/5 of all burdens. About 1 in every 7 Kuwaiti men and 1 in every 8 women will develop cancer by the age of 75. As you can see in this graph, the age standardized incidence rate, together with a 95% confidence interval, upper limit and lower limit, starting from year 1974 up to year 2011. As you can see, this is for Kuwaiti males, and this is for Kuwaiti females. As you can see, that the age standardized incidence rate is going up and down over the year. However, the overlapping pattern of the 95% confidence interval indicates that changes are of no statistical significance. Between 1974 and 1984, thyroid cancer ranked the second most common cancer site after breast. Thyroid cancer incidence rate increased slightly, and it ranked the third most common cancer site after breast and colorectal cancer. This is among Kuwaiti females. In 2011, thyroid cancer ranked the 10th most common cancer site among Kuwaiti males and the second most common cancer site among Kuwaiti females. As for non-Kuwaiti patients, thyroid cancer ranked the 7th most common cancer site among males and the second most common cancer site among non-Kuwaiti females. According to GloboCan 2012, thyroid cancer was found mostly in North America. It ranked Kuwait the sixth in the highest 20 countries as regards the incidence of thyroid cancer in Western Asia. And according to GloboCan, thyroid cancer ranked the 8th most common cancer site in Kuwait. The mortality incidence ratio of thyroid cancer is 0.06, which is very low. And thyroid cancer ranked the 4th most prevalent cancer in Kuwait after breast, colorectal, and leukemias. In this graph, you can see the number of cases in both male and female, and the age standardized rates presented in lines. You can see that the number of cases of male increased from the 70s up to the duration between 2000 and 2009. It increased by about 4-folds. And for females, the number of cases increased by about 6-folds. However, if we are taking the population increase into consideration, the age standardized incidence rate for male increased only by 1-fold, and for females by 2-folds. The male to female ratio in the 70s was 1 to 2, and now in between 2000 and 2004 it is 1 to 4. Again, if you can see the age-standardized incidence rate over the years, starting from the 70s, 80s, 90s, and between 2000 2009, in males and in females, you can see that the age-standardized incidence rate is increasing. However, the overlapping pattern of the 95% confidence interval indicates a non-significant change. Kuwait Cancer Registry is expecting the number of cases of Kuwaiti females to reach about 450 cases per year in 2020-2029, and the number of cases in Kuwaiti males to reach about 100 cases in the same duration. However, the age-standardized rate in females will increase to reach about 11 cases per 100,000 population, and for Kuwaiti males to reach about 5 cases per 100,000 population. As for the data of Kuwait Cancer Registry for year 2011, this is the latest report in our registry. Females predominate the sex distribution in both Kuwaiti and non-Kuwaiti patients. And about 50% of cases aged less than 40 years. Mean age at diagnosis for Kuwaiti and non-Kuwaiti was about 40 years. Majority of cases presented from areas or were living in areas like Farwaniya, Hawali, and Capital. In both Kuwaiti and non-Kuwaiti, there is no difference. Papillary carcinoma was the most commonly morphological picture seen, presenting about 85% of cases. Well-differentiated carcinomas are the mostly seen picture. 1/3 of the cases presented initially with localized disease. About 20% presented with regional disease, and only 3% presented with metastatic disease. Almost 100% of cases were morphologically verified. Majority of cases were submitted to surgery. About 60% to 70% of cases received radioactive iodine, and about more than 90% of cases are under hormonal treatment. For women diagnosed with thyroid cancer between year 2000 and 2011, the age peaked at the 30 to 34 age group. And for males, the age peaked at 35 to 39. Those who aged less than 50 years has low incidence of thyroid carcinoma. Comparing the morphological pattern of thyroid cancer in the 80s to this of between year 2000 and year 2011, you can notice that the papillary carcinoma presented about 80% in the 80s, and now it is accounting for about 88%, on the expenses of follicular carcinoma, which decreased from 12% in the 80s, and now it is about 5%. Thank you.